أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله تعالى وبركاته رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. And welcome to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat, coming to you live this week from beautiful Mother City, Cape Town. Once again, we've got an interesting topic of discussion. We're going to talk about cupping therapy with the IMA member live in studio. But before I introduce him, let me introduce myself. My name is Najwa Mohammed Ladi, and let me start off by reading the tarbiyah of tonight's program, inshallah. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Ibn Abbas reported that the Prophet, peace and blessings be upon him, said, "Healing is to be found in three things: drinking honey, the knife of the cupper, and cauterization of fire." Reported by Al-Bukhari 10, verse 136. According to a hadith narrated by Jabbar, may Allah be pleased with him, the Prophet, peace and blessings be upon him, said, "If there is any good in your medical treatments, it is in the knife of the cupper, drinking honey, or cauterization with fire as appropriate to the cause of the illness. But I would not like to be cauterized." Reported by Al-Bukhari 10:139. According to a hadith narrated by Anas ibn Malik, may Allah be pleased with him, the Prophet, peace and blessings of Allah be upon him, said, "I did not pass by any group on the night when I was taken on the night journey, which is the Isra, ascension to the heavens, but they said to me, 'O Muhammad, tell your ummah to do cupping." Reported by Ibn Majah. It has corroborating evidence which strengthens it. Ibn Abbas, may Allah be pleased with him, with both of them, reported that the Prophet, peace and blessings be upon him, was treated with cupping, and he paid the cupper his fee. Reported by Al-Bukhari 10:124 and Muslim 1202. Anas ibn Malik, may Allah be pleased with him, reported that the Messenger of Allah was treated with cupping by Abu Tayyiba. He commanded that he should be given 2 measures of food, and he spoke with his tax collectors who reduce his taxes. He said, "The best treatment you can use is cupping." Reported by Al-Bukhari 10:126 and Muslim 157. Sadaqallahu al-Azim. Once again, mashallah, beautiful tarbiyah. Related to our topic of discussion this evening, we're discussing cupping therapy with IMA member Dr. Mujib Hussain. Assalamu alaikum wa rahmatullahi wa barakatuh, Doctor.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
How are you, Doctor?
I'm well, sir.
Jazakallah, very well. Alhamdulillah. Shukran so much for being here and giving us such, obviously, I know you are well known when it comes to the cupping remedies and the therapies, inshallah. So shukran for being here, Doctor. And I want to inform our viewers, we will be opening our lines very, very soon, inshallah, for you to be part of this wonderful program, inshallah, because I'm also aware that people as far as Harare, Zimbabwe, are also watching our program due to our wonderful IMA convention that we had last week, alhamdulillah. Before I do ask Doctor all these wonderful, niggly, interesting questions regarding cupping, let me inform our viewers about our activity for the week. The Islamic Medical Association is a national non-profit organization that has been in existence for over 30 years. It has numerous projects under its banner, and this week, once again, we want to remind our viewers about the renal dialysis project that was launched in Durban, November 2007, in Gauteng in October 2011, and in Cape Town in January 2014. The main purpose of this project is to provide funds to the underprivileged patients who do not have the financial means to continue their chronic dialysis treatment regimens. So the renal dialysis is a means of survival for so many patients suffering with chronic kidney disease, and it is of course a very, very costly form of treatment, and the criteria governed by limited funding forces numerous patients to be excluded from the state program. Financial assistance is needed in the form of donations, which can comprise of zakah or lillah, as it is solely needed for us to sustain the renal dialysis project. And we want to ask our viewers to donate generously if you're able to, inshallah, by contacting our IMA offices in Cape Town, and the numbers do appear on your screen, alhamdulillah. Well, back to my very special guest, Dr. Mujib Hussain is an IMA member as well, and I want to ask Doctor just to give us a little brief about yourself, please.
Okay, I'm an academic and researcher. I train doctors in United Medicine.
Okay.
I'm also involved in various community-based projects that introduces Tibbanabui, prophetic medicine, the revival of Tibbanabui.
Yeah.
So I'm very in touch with all references within ahadith, and I present it in the light of modern scientific findings.
Right.
So my interest is mainly revolves around healthy living according to the Sunnah and health promotion.
Amin, inshallah. And that is our topic this evening. So we want to encourage all our viewers. The lines are open immediately if you'd like to participate, and we want to encourage you to participate in our program on 02169600109. Doctor, cupping therapy. Please explain to us what exactly is cupping therapy.
Cupping therapy is a complementary therapy. It's a body manipulation therapies that falls in the same category as massage, acupressure, acupuncture. So it involves contact with the skin. The cupping tools or instruments that are used consist of a cupping gun and bell-shaped cups. And the objective of cupping therapy is to target certain points on the body. So the suction gun would be attached to the cup, and with a few suctions the skin will raise, causing a uplifting of the skin known as skin doming. And this would be applied to various areas of the body in order to induce physiological changes. So we manipulate the blood circulation through the cupping therapy. Basically we have two types of cupping. There's dry cupping. Dry cupping simply refers to the application of the cups onto an area, and it's preceded by application of certain oils. Then we have wet cupping, which follows the dry cupping procedure, except it will be followed by light skin scarification, which means light puncturing of the skin in order to allow tissue fluids to leave the underlying surface. So cupping essentially is a excretory mechanism. It's an excretory therapy. So it's a form of detoxification, a blood cleanser.
Okay, all right. Jazakallah so much. The lines are open for all our viewers to participate this evening. We're discussing cupping therapy with Dr. Mujib Hussain, and you can call us, and the telephone numbers do appear on your screen. And of course, for all those visually impaired viewers, 02169600109 to be part of this very interesting topic of discussion, alhamdulillah. Doctor, cupping, where did this originate really?
So we find, if we look at just about every ancient civilization that ever existed, we'll find traces of cupping therapy. It goes as far back to the ancient Egyptians, where on the tombs of the pharaohs we would clearly see pictures of cupping tools. In actual fact, during the time of ancient Egypt, cupping was considered to be the medicine of the elite. We find cupping therapy well practiced by the father of medicine, known as Hippocrates, Galen, Ibn Sina, and all the Islamic physicians that provided the foundation to modern medicine as we know it today. So we find cupping therapy well established in Europe. So due to the famous physicians of the past, cupping was practiced right up to the 1900s in Europe. We find evidence of cupping in African medicine, where the cupping tools that were used were seashells and the horns of animals in place of bell-shaped cups. Cupping is also well known in Chinese medicine. But without a doubt, the greatest contribution to cupping therapy comes from the Islamic Empire. And that is all based on the narrations that you mentioned at the beginning of the show, where the Prophet ﷺ clearly, explicitly endorse cupping therapy as one of the best forms of medicine.
Yeah. There you have it. Alhamdulillah. Please be part of our program this evening. We're coming to you live from beautiful Mother City, Cape Town, and we're discussing cupping therapy with Dr. Mujib Hussain. The lines are open for you to participate. Alhamdulillah. Doctor, you did mention, where it originated from, and over so many years. What is the prophetic medicine, and how does that really relate to the cupping?
Prophetic medicine, also known as Tibb Nabawi, refers to the advice, the recommendations, the prohibitions, the tacit approval that the Prophet, peace be upon him, gave to the Sahaba, so to his ummah, to his followers, in relation to healthcare, to health promotion, disease prevention. And it involves various modalities. It involves dietotherapy, it involves body manipulation therapies, it involves oral hygiene, physical hygiene. And what's amazing is that we find in modern medicine today, in environmental medicine and behavioral medicine, that every narration of the Prophet, peace be upon him, has major significance to every part that makes us human. To the physical body, to the emotional self, to our mental faculties. So without a doubt, in today's time, we find a great revival in the science known as Tibb Nabawi. And one of the most celebrated aspects of Tibb Nabawi would be cupping therapy. And there's about 28 ahadith on cupping that mentions the benefits of cupping therapy. And this was the reason why the physicians of the past were so great, because they relied on these ahadith. And we find that during the Islamic Empire, the Muslims contributed greatly to medicine, because the Prophet ﷺ said in hadith, he mentioned the likulli da'in dawa, that for every illness is a cure. And during the lives of those physicians, they cured what was termed incurable diseases, simply based on their faith. They knew that there was no illness on this earth except that it was sent down with its cure, and due to that, they cured many illnesses in their lifetimes.
Okay, Jazakallah so much, Doctor. We're discussing cupping therapy here this evening on Health Matters Comprehensive Chat, coming to you live from Cape Town, and the lines are open 0216960109 with Dr. Mujib Hussain. We need to go for our first ad break, inshallah. But to all our viewers, stay with us. We'll be back shortly, inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and welcome back to Health Matters Comprehensive Chat. We're discussing cupping therapy here this evening with Dr. Mujib Hussain, and the lines are open and the numbers do appear on your screen to be part of this very interesting topic of discussion. It's cupping therapy, and Dr. Mujib gave us, when you open, asking about where did this originate, why do they use this kind of therapy, and they gave us such a beautiful brief, alhamdulillah. So Dr. Mujib, maybe you must just tell our viewers what are the benefits of cupping, inshallah.
So to understand the benefits, we have to look at basic anatomy and physiology. So firstly, dry cupping. Dry cupping is very beneficial for pain-related conditions. So dry cupping can induce an analgesic effect. So if you look at pain, the way pain is perceived by the body, we find that receptors beneath the skin, known as nociceptors, picks up pain messages either due to a break in the skin or due to any internal inflammation or swelling, and these messages travel through what we call C fibers to the spinal cord. The messages go up to the brain and we perceive it as pain. When we apply cups to the skin and we apply the internal negative pressure, or we create a suction, we trigger what is known as mechanothermoreceptors. So those receptors that are designed to pick up changes in temperature and changes in movement. And once those receptors are triggered, we find that the messages are blocked at the interneuron level. So in other words, cupping therapy blocks pain reception. So therefore we find cupping very effective for pain-related conditions, so musculoskeletal problems. There's various evidence-based journals to show the efficacy of cupping for conditions like rheumatoid arthritis, osteoarthritis, carpal tunnel syndrome, etc.
Doctor, we've got a caller. Can we go to the lines,
Sure.
please? Let us go to the lines. Assalamu alaikum and welcome to the program. Wa alaikum salam.
Can you hear me?
Yes, we can.
I'd like to ask the doctor with this cupping, can you by any chance hit a nerve for, and the other question is, could there be any side effects with cupping?
All right. Is that your only questions, brother?
Yes.
Okay. Thank you very much for the
Thanks,
question. You can listen on the television. Jazakallah. Doctor?
Okay, so cupping therapy is a medical procedure.
Yeah.
So definitely with every medical procedure, there is a protocol to follow.
Right.
There are contraindications, adverse effects. Therefore, seek cupping therapy from a registered practitioner. A practitioner, when they register, it means that they are trained in anatomy, physiology, pathology, disease processes, and they understand the theory and the practice of cupping. So yes, if cupping is practiced incorrectly, it can cause damage. So therefore we know we shouldn't cup on certain areas that are injured. We shouldn't cup on mold. We shouldn't cup on varicose veins. We should do a proper patient history. So the cupping procedure is anything between 5 to 10 minutes, 5 to 15 minutes, but the actual build up to the cupping,
Right.
the diagnosis, the
Yes.
patient history takes longer. It takes up to half an hour to do a thorough history to ensure that we are ensuring patient safety. So definitely, if you seek cupping from an unregistered or untrained practitioner, the results could be catastrophic. So definitely, cupping is a medical procedure and it requires the correct protocol to be followed.
Doctor, how will we know? I'm just asking the layman question. How will I know if I go to a cupping therapist that that person is actually registered?
At the moment, we have regulatory bodies in South Africa. Personally, I'm the chairman of the South African TIB Association. So
Okay.
in our association, we work tremendously hard to ensure that the cupping practice is regulated,
Right.
and we contribute to the regulation through research. So definitely, if you contact our organization, we can direct you to registered cupping practitioners. And the training that we received in South Africa required 5 years of full-time study. So it's a double bachelor's, a degree in medicine, a degree in complementary medicine. So I can only speak for our qualification because it's recognized in the country. So I cannot comment on anybody else's form of treatment because
Right.
I wouldn't know where they, the institutions they connected to, were they taught anatomy, physiology. All of those subjects are very important.
Should the therapist display his or her qualifications? Will that make a difference?
That would be standard practice.
Okay.
To display, it's not a sign of pride or arrogance.
Yeah.
It's a sign to show that you're competent.
Okay.
And if you look at the ahadith of the Prophet ﷺ, it's clearly mentioned he went to a cupper for cupping,
Right.
illustrating that cupping cannot be performed by any person.
Right.
And one of the reasons which led to the decline of cupping was the fact that cupping became so widespread in Europe, it was practiced by the layman,
Okay.
which led to malpractice. And we
Yes.
find it happening today,
Yes.
especially in Muslim societies where people attach cupping to sunnah, but they forget that the sunnah should be held high.
Right.
So people consider that cupping is sunnah, so everybody can get cupped at any time. That's not true. There's a
Okay.
process to follow, which entails diagnosis,
Okay.
understanding body types, temperamental evaluations, and the list goes on.
Doctor, this is another caller. Can we
Okay.
go to the line?
Sure.
Let us go. Assalamu alaikum and welcome to the program.
Walaikum salam wa rahmatullahi wa barakatuh.
Walaikum
Dr. Mujib, I have one question. Where could we have cupping done in Cape Town? Which centers would you recommend?
Yeah, the two main centers in Cape Town would be the TIB Medical Center, which is under the auspices of the Ibn Sina Institute of TIB. Then we have the Sama Center of Integrative Health, which is a wellness spa-like center. And then we also have TIB practitioners scattered all over the country in various provinces. So if you contact the South African TIB Association or the Ibn Sina Institute of TIB on their website, tib.co.za, so it's www.tib.co.za, they will be able to direct you to the closest cupping practitioner in your area.
Okay. Doctor, will we be having that details just before we conclude our program?
Yes, definitely.
Inshallah, inshallah. So we will be having those details on the screens, inshallah, for all our viewers. But please be part of our program by dialing the telephone number on the screen. Doctor, there's another caller holding. Let us go. Assalamu alaikum and welcome to the program.
Are you talking to me?
Yes, I am. Hello. Assalamu alaikum.
Alaikum salam. I'd like to know, does cupping help? Will cupping help to stop smoking?
Mashallah. Good question, my dear. Is that your only question?
Yes.
Okay, doctor will answer, inshallah.
Okay.
Doctor?
Okay, that's quite a tricky question.
Okay.
When it comes to smoking habits, we have to understand it's multifactorial.
Right.
So there's a lot of psycho aspects involved, like psychosocial aspects, and
Yeah.
Linking the triggers that
That's
you know
right.
allow people to feel the need to smoke.
Mhm.
However, cupping can be used as a perfect adjunct therapy as a detox process to help to cleanse the blood of the nicotine addiction alongside strengthening the liver, because we know that basically every cell undergoes quite a heavy toxic load due to smoking. So definitely cupping can assist. Whether cupping can stop your smoking, that depends on you. But definitely as an adjunct therapy to assist the body to rid itself of this waste, cupping therapy is ideal.
Okay, shukran so much. That's such a beautiful question, Doctor, because we know we a couple of days away from the holy month of Ramadan, and inshallah, I'm sure the lady would love to make that change before Ramadan, inshallah. So as Doctor said, it might. So you are also most welcome to contact the numbers that will be appearing on your screens before we conclude our program, inshallah. Cupping therapy, that's our program this evening, and the lines are open. You are most welcome to be part of this very, very interesting topic of discussion with Dr. Mujib Hussain, and Doctor's been giving us great advice, alhamdulillah. Doctor, as we are waiting on our callers, maybe you can just continue with the benefits of the cupping, inshallah.
Yeah.
Okay.
So we mentioned the benefits of dry cupping, so we'll move on to the benefits of wet cupping. So to understand the benefits, we also again have to look at the basic physiology of the skin. So under normal circumstances, we find that every cell of the body, through the process of metabolism, self-correction, excreting free radicals, it would move harmful substances out of the cell into what we call the interstitium. So tissue fluid between cells in the body. And constantly the capillaries would reabsorb and filter the blood constantly. When we find a disease process, one thing is common to all disease processes. We find that there's abnormal blood chemistry. So we find that there's inflammatory markers, inflammatory cells, macrophages that destroy certain cells, so there's bacterial byproducts left. We find in conditions like thalassemia, there's overaccumulation of ferritin and iron. In gout, there's overaccumulation of uric acid, and cupping is very effective in removing that.
Okay.
Through the
Doctor,
skin.
sorry, there's another caller. Can we go
Alright.
to the lines? The lines are very busy, alhamdulillah. Assalamu alaikum and welcome to the program.
Walaikum assalam.
Walaikum
Shukran.
assalam.
Can I
Jazakallah.
ask Doctor a question, please?
Yes, please go ahead, sister.
Yes. You know, I'm a cancer patient and I'm in remission at the moment. But I just wanted to know, can cancer patients do cupping as well?
We find that the cupping that we practice today is based on evidence, so evidence-based medicine. So whilst there's many conditions that has been proven to be effective with cupping therapy, like rheumatoid arthritis, there is still ongoing research when it comes to cancer. So I don't rule out the benefits of cupping for cancer, because we know that that cupping therapy can clear the blood. However, we have to note that different types of cupping will be applied to different stages of cancer. So I wouldn't be as bold as to give a blanket statement. Rather, seek a consultation with a cupping practitioner and they will advise accordingly. So cupping can be used as an adjunct therapy to relieve the stress or decrease the adverse effect of cancer therapy. So there are benefits of cupping therapy for cancer patients.
Okay. Thank you so much to that. Afwan, my dear, is that your only question?
Yes, thank you so much.
It's only a pleasure. Jazakallah so much. Thank you very much. Walaikum salam wa rahmatullah. rahmatullahi wa barakatuh. We're discussing a cupping therapy this evening with Dr. Mujib Hussain, and the lines are open and the number do appear on your screen. Please make use of that to be part of this very, very interesting topic of discussion, inshallah. Doctor, sorry for the interruption, but we, alhamdulillah, we're very blessed if people participate. You know, we're honored to be participating in our program. So you may continue, inshallah.
Okay, so we mentioned that during disease states we find abnormal blood chemistry. So if we were to look in blood, we will find that there's irregular accumulation of some substances. During the cupping process, once the cup is applied to the skin, it alters the chemistry of the blood. So as the cup placed on the skin and we find there's suction, we find that the skin uplifts and the skin doming that takes place. At one end, we'll find that the arteriole starts to filter.
Okay, sorry doctor, there's another caller. Let us go to the lines. Assalamu alaikum and welcome. Oh, we're sorry, we've lost that caller. Please do try and call again on the number that appears on your screen, and Dr. Mujib Hussain will try his utmost to assist, inshallah. Sorry, doctor.
Okay, so once the cup is placed on the skin, it creates negative pressure, and we find that at the end of the capillary where filtration takes place, due to the high pressure in the cup, the capillary would have a low pressure. So this would cause a pressure gradient.
Yeah.
So according to physics, to Boyle's law, the filtration rate increases. So we find there's a strong movement of bacterial waste out of the pores into the area that's being cupped. And what normally takes place, there would be absorption at the venous end. But because cups is placed on the skin, the absorption stops there. So in other words, the capillary stops absorbing the harmful blood, and the blood is collected in the cup.
Okay.
So it's a concentration of harmful substances in the cup.
Yes.
Because the capillaries are like pipes within the body, and there's pores that allows the movement of very small molecules through there, very small substances. So substances that measures in nanometers, like fragments of damaged blood cells, or pathogenic substances, but whole blood cells wouldn't be able to fit through there. So cupping actually draws all of that to one point.
Okay.
Once the cup is removed and the practitioner applies the blade, so there's light scarification. So paper light cuts are done on the skin. So light puncturing on the skin no deeper than 0.1 millimeter into the skin. And we'll find that the skin will start to bead fine droplets of tissue fluid.
Wow.
And that tissue fluid contains these harmful substances.
Dr. Shukran so much. We need to go for another ad break, inshallah. But when we return, we'll be continuing with cupping therapy, inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and welcome back to Health Matters Comprehensive Chat. We're discussing cupping therapy with Dr. Mujib Hussain. And there's a caller holding, I believe. Let us go to the lines. Assalamu alaikum and welcome to the program. Hello?
Hello?
Yes, can you hear us?
I can hear you.
Please go ahead with your question, brother.
Wa alaikum salam wa rahmatullahi wa barakatuh. Hello?
Can you just tune your volume of your television, please?
Okay.
Thank you.
My question to you would be, okay, just hold on.
Okay. Thank you very much for that. Go ahead, brother.
My question to you would be, would cupping assist people that suffer with diabetes?
Okay.
Is that your only question, brother?
Yeah, that, and the other thing is blood circulation. Would it improve blood circulation as well?
Okay, all right. Jazakallah so much. Thank you very much. Doctor will answer, and you can listen on your television. Doctor?
Yes. We find that most body manipulation therapies improve blood circulation. And cupping has been shown to be one of the most effective deep tissue massages known to man, in that it affects 4 inches into bodily tissue. So definitely cupping therapy does increase blood supply to the affected area. So we know that in the complications of in diabetes are certain blood circulatory problems to the extremities, So definitely cupping therapies on various points of the body. So prescribed points at different areas will increase blood supply. And studies have shown that cupping therapy can bring about stabilization of sugar. So depending on other lifestyle management programs, very important to note that cupping therapy should never be used as a main therapy without practicing the rest. So the Prophet, peace be upon him, said that cupping therapy is one of your best medicines, but we have to adopt the entire sunnah, which means lifestyle factors. So what we consume alongside cupping therapy will be very beneficial for diabetes.
Shukran so much, Dr. Mujib. And the lines are open, 021 8321 900, 021 8321 900, to be part of this interesting topic of discussion. We're discussing cupping therapy here this evening. Doctor, the benefits, you were still talking about the benefits of cupping, inshallah.
So I mentioned that once the cup is applied to the skin and all the harmful substances will be brought within the cup, we find if we were to measure or we were to look at that the composition of the tissue fluid, we'll see that it's highly concentrated in uric acid, pathogens, in old damaged red blood cells. So definitely the tissue fluid that would be circulating in the blood would be confined to the cup. So once the blade is once scarification takes place, we find an immediate release of the toxins beneath the skin.
Okay. Doctor, there's another caller. Let us go to the lines. Assalamu alaikum and welcome to the program.
Walaikum salam.
Walaikum salam. Please, you can go ahead with your question.
Make it loud. Assalamu alaikum.
Walaikum salam wa rahmatullahi wa barakatuh.
I would like to ask doctor if I've got osteoarthritis in my knees. Now, will the procedure, will the cupping be done on my knees or else in my body, please?
Is that your only question, my brother?
That's all.
Okay, Jazakallah so much. Doctor will answer and you can listen on the television. Thank you very much.
So cupping therapy requires the demarcation of the cupping sites. So we administer two forms. We have what we call local sites and distal sites. Local sites means that in a case of osteoarthritis, we apply cups as close to the inflamed or painful area as possible without increasing that pain, which will have an immediate effect on the surrounding area. Then we could also employ distal sites, whereby we'll cup on the area of the vertebra that corresponds to the innervation of that anatomical site. So in other words, the knees are affected, so we'll be cupping around the knee as close to the inflamed area or the injured area as possible, and we would cup on the lower back. So from in the L region, the lamina region, towards the sacral region, because those will be the areas that innervates the lower limbs. So it's a two-prong approach, a direct and through the dermatomes.
Okay. Thank you very much, Dr. Mujib. Dr. Mujib, I also just want to ask, if patients come to, to a registered professional that can do the cupping, and the person are being diagnosed with a chronic illness, is it a process that they must follow in terms of the cupping, and not thinking one visit might cure them? But there's a caller. Before you answer that question, inshallah, let us go to the lines. Assalamu alaikum and welcome. Hello?
Hello?
Yes, you can go ahead with your question. Can you just lower the volume?
I'm holding on.
Can you just lower the volume of your television, please?
I can't hear you.
Can you just lower the volume of your television?
Yeah.
Thank you very much. Thank you. You can pose your question, brother.
Excuse me?
You can go ahead with your question.
Must I tell you what I want to know?
Yes, please. Dr. Mujib is listening.
Yes. You see, I'm suffering from eczema and itchiness and rash on the body, and I just can't get it. It's always starts from the hand and the back and everywhere.
Okay.
And is that your only concern, only question to the doctor?
Yeah, and then if I have a cupping in Johannesburg, what do you recommend?
Okay. Thank you very much, brother. You can listen on the television. Jazakallah so much. Doctor?
Okay, very important to note that when you obtain cupping from a registered TIB practitioner, it means that they are practicing cupping according to the TIB philosophy. So there's a method of diagnosis of treatment that differs to what Western or conventional medicine. And the method employs understanding the body from what you call a humoral perspective. So we look at the individual, we look at the effects of each organ, and we look at how the illness manifests externally. So in the case of skin conditions, it indicates to us that the body's detoxification process is hampered severely in that it manifests at this level of the skin. Most often the body is able to move any accumulation of toxins through the necessary routes, through urination, defecation, through the sweat glands. But when it presents at the level of the skin, it means that cupping therapy can improve excretory measures through the skin, but it would also require a detoxification program in the form of herbal treatment, or we target the liver, we look at the diet. So like I said, when it comes to cupping therapy, it can be very beneficial as an adjunct therapy. So for cases like eczema, yes, it is beneficial alongside other modalities as well.
Dr. Mujib, there's another caller. Let us go to the lines. Assalamu alaikum and welcome to the program.
Walaikum salam.
Walaikum salam. You're most welcome to pose your question to Doctor.
Yes, please.
Go ahead, brother.
Okay, thank you. Tell me, sorry, excuse me. Assalamu alaikum. I'm insulin-dependent diabetic. I need to know, cupping, if you do the cuts, will the wound heal or will it take longer? I'm just a bit worried about that. And also I'm on blood thinning tablets, Plavix, because they put some stents into me.
Yes.
So I want to know, can I do cupping while I'm on that medication?
Thank you very much, brother, for the question. Doctor will answer, inshallah, and you can listen on television.
Okay,
thank you very much. Walaikum salam wa rahmatullahi wa barakatuh.
Okay, so this is where the patient history is very important. So when you seek advice from a medical practitioner in cupping therapy or a cupping practitioner, you'll find...
Dr. Mujib, we need to go for an ad break, inshallah. When we return, Doctor will continue with that answer, inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh, and welcome back to Health Matters Comprehensive Chat. It is our last segment this evening, but the telephone numbers do still appear on your screens and you are most welcome. But Dr. Mujib Hussain will continue with our last caller before we took our break about insulin-dependent diabetes. Dr. Mujib?
Yes, a recap on the question. The patient asked, insulin-dependent patient, and he is asking, will cupping therapy harm in any way, since there's cutting involved or skin scarification, and he was a bit afraid about the bleeding aspect. And as mentioned before, we said that the thorough history taking is important in order to rule out the use of certain medication, in order to ensure that the patient fits the ideal role or fits the profile of a cupping patient in terms of wet cupping. Also important to realize that there's various forms of cupping that benefits diabetic patients. So depending on the stage of diabetes and any complications involved, we would employ wet cupping for some, dry cupping for some, the use of certain oils like black seed oil to increase blood circulation, or dry cupping on the lower extremities to improve the feeling, the sensation, or removing of pins and needles, etc., alongside dietotherapy. The patient also asked, are there any cupping therapists in Johannesburg? Definitely there are. And you should contact the Ibn Sina Institute of Tib for those numbers.
And the numbers will appear, inshallah, just before we conclude our program on the last slide. Doctor, there's a caller holding. Let us go to the lines. Assalamu alaikum and welcome to the program.
Walaikum salam.
Walaikum salam. Please pose your question to Dr. Mujib.
Yes, please. Doctor, I am 73 years old and I go through depression, and doctors have put me onto Vanlor and Cipralex, but it's doing nothing for me. Will cupping help me?
Inshallah. Doctor will answer, my sister, and you can listen on the television, inshallah. All the best. Jazakallah so much. Walaikum salam. Doctor?
What we find today is that there is extensive research in the benefits of cupping as adjunct therapy to conventional medicine. So we found in patients with various conditions that when cupping therapy is applied, it improves the efficacy of the medication. So it's found, and what it's based on the hadith, the Prophet ﷺ said that if there is any type of therapy that allows a medication to find its site, it would be cupping therapy. And today there's several studies. So definitely cupping therapy would assist you alongside the necessary counseling, the dietotherapy, and the use of medication.
Okay, shukran so much, Dr. Mujib. There's another caller holding. Assalamu alaikum and welcome to the program.
Assalamu alaikum.
Wa alaikum salam. Please pose your question, brother.
My question is, I want to know whether MS can be helped by the cupping process.
Thank you very much. Thank you very much for the question. Wa alaikum salam wa rahmatullahi wa barakatuh. Dr. Mujib?
Yes, I have found several journal articles mentioning that in multiple sclerosis that cupping does improve, because in those type of conditions, autoimmune conditions, we find that there's a high accumulation of inflammatory markers, high accumulation of CRP, of different markers which indicates to disease progression. And when cupping therapy is applied, especially wet cupping therapy, it has been shown to correct these markers. And when these markers are corrected, it directly links to improvement of symptoms. So definitely cupping therapy can assist.
Okay. Shukran so much, Dr. Mujib, and to that caller for posing that question. Doctor, I did ask about, the cupping. Is it a process that the patient needs to go under to see any results, really?
Yes. So every patient is different.
Okay.
So we find in certain conditions like sciatica, some patients could they could undergo one treatment and find immediate relief.
Okay.
Some would need a 3-week treatment. So different patients would feel it would benefit from cupping in different ways. So some patients would undergo a longer process. So it just depends on how deep the pathology lies in the body.
Okay. There's another caller holding. Let us go to the lines. Assalamu alaikum and welcome to the program. I'm very well, alhamdulillah, Dr. Mujib. Jazakallah so much for calling us.
Sure.
Yes, please go ahead.
Doctor, tell me, is cupping good for people that got the slip disc? And is cupping going to work for people that have pinch nerves?
Okay, shukran so much, dear, for that question, and all the best, inshallah. Wa alaikum salam wa rahmatullahi wa barakatuh. Doctor?
Yes, we find definitely when because we say that cupping definitely inhibits pain at the interneuron level, so it does help a lot with slip disc, with back-related injuries, with various pain-related conditions.
Okay.
But as mentioned earlier, the level of pain relief varies according to patients.
Okay.
We also have to acknowledge that there's certain diets that would be given to these individuals, because there are certain foods that contribute to the inflammatory process. Okay. So when all of these processes come together, we find that cupping proves to be most effective.
Okay. Dr. Mujib, shukran so much. I believe you've also got a message to our viewers regarding registered professionals, cupping therapists.
It's very important to realize that cupping therapy enjoys strong evidence today. So a few years back, there weren't many randomized control trials, there weren't many evidence-based journals, but today cupping therapy is well supported. And it's very important to note that cupping therapy should be sought by a registered practitioner. So there are various practitioners within the field of Unani TIB. So TIB practitioners in South Africa undergo a rigorous program in training, and they are registered through a regulatory body to practice cupping therapy. And the numbers will be made available at the end of the show.
And we're requesting the last slide for the viewers basically to see, inshallah. Doctor, is there a website that the viewers can go?
The Ibn Sina Institute of TIB is a Waqf organization, a community-based organization that promotes the practice of TIB. In cupping therapy, there are various articles on the website. So go to the website www.tib.co.za, and the Samar Center of Integrative Health practices cupping therapy, registered cupping practitioners, as well as the TIB medical centers. And there are other individuals within Cape Town. We have Dr. Stark within Marina de Gama. We have Dr. Mauser within the Rondebosch area. So various areas in Cape Town, there are practitioners that practice the art of cupping.
Dr. Mujib, I only have time to say to you, Jazakallah so much for a wonderful, wonderful program. May Almighty Allah reward you, inshallah.
Shukran.
All the best. And to all our viewers, Jazakallah so much. Thank you very much for a wonderful, wonderful program and for participating in our program. Next week, inshallah, we'll be having a dietitian in studio, because we will be talking about dietary preparations for the month of Ramadan. We know it's in a couple of days, inshallah, because today it's the 4th of Shaban. So in a couple of days, inshallah, we'll be celebrating or enjoying the beautiful month of Ramadan. So next week, do stay tuned and return to us. We'll be discussing wonderful information regarding dietary preparations for the month of Ramadan. Another reminder, please watch the show, the repeat on Sunday mornings, inshallah. From myself, Najwa Muhammad Ladi, and my IMA member, Dr. Mujib Hussain, want to wish you a beautiful, healthy week ahead. Fi amanillah. Wassalamu alaikum wa rahmatullahi ta'ala wa barakatuh.